Hello, this is Dr. J. Davidson from drjdavidson.com. I'm excited to welcome you to this very special segment of the Chronic Lyme Disease Summit. According to the CDC, there are more people affected with Lyme disease each year than breast cancer. That's including invasive and non-invasive together. Today, my special guest is Dr. David Minkoff, and we're going to address comprehensive Lyme treatment strategies. But before we do, a little bit about Dr. Minkoff. Dr. David Minkoff graduated from the University of Wisconsin Medical Center in 1974 and was elected to the Phi Beta Kappa of medical schools, the prestigious Alpha Omega Alpha Honors medical fraternity for very high academic achievement. He then worked for more than 20 years in the area of traditional medicine before making the major switch to alternative medicine when he and his wife Sue founded LifeWorks Wellness Center in Clearwater. LifeWorks is now one of the country's foremost alternative health clinics, offering a wide range of cutting-edge protocols. In 2000, Dr. Minkoff founded Body Health, a nutrition company which offers a unique range of dietary supplements to the public and practitioners. Dr. David Minkoff is passionate about fitness and is a 41-time Ironman finisher, including 8 appearances at the Ironman World Championship in Hawaii. He also writes 2 weekly newsletters, the Optimum Health Report and the Body Health Fitness Newsletter. Dr. Minkoff, welcome.
Thanks, Jay. Great to be here with you.
Well, I see University of Wisconsin Medical Center, 1974. That happens to be the same town my wife grew up in, which contracted chronic Lyme disease. So I find that rather ironic. Did you grow up in that area too?
I did. I grew up in Madison. I went to high school and college in Madison and med school. And then when I finished med school, I went to UC San Diego after that. But when I was growing up, there was no Lyme disease. It was unknown. But it's funny, my brother has a place just outside of Madison, and we were there actually last Thanksgiving walking around in the woods, and 2 of my grandkids had ticks, and my brother had a tick just from a walk in the woods in the cold just outside of Madison. So they're swarming there.
It's amazing how much things have changed. And my wife was born in 1982, and when she was 7 years old is when her whole coma for 6 weeks, got sick of chronic Lyme. So that'd be about 1989 roughly. So obviously from that point of graduating to, somewhere around there is kind of when the tide started turning. So I just really want to dive in. I mean, with all the different illnesses that are happening, not only in America, but really across the globe, there really seems to be a set of what we'd call, predisposing circumstances where somebody could get an infection or even in some can continue really into a chronic condition. Obviously, with your specialty in Lyme and focus in Lyme disease, what are the factors that seem to be coming up most in patients that really need to be handled for somebody to get better?
Well, what I found, we have people from all over the world that come to our center, to LifeWorks Wellness Center, who have Lyme. And their Lyme disease is usually secondary to a whole bunch of other things that are going on in their body that if we correct, their chances of getting better from their Lyme disease are really very good. About 85% of the people that we see get better, and a lot of them are really sick. So I think the sort of the body is out of sorts to begin with. I think these Lyme organisms have been around for, if not thousands, millions of years. They take advantage of a host that's damaged, and if we can reconstitute the host or the basic general things that the body's supposed to do, I think people can get better with the right therapy. Now the first thing or the biggest thing that I find that's wrong with some patients with Lyme, but it's a lot of them, it's probably 80%, is that they have dental problems. They have gingivitis, dead teeth, root canal treatments of teeth, cavitations in their jawbone, and often when we test them on first sort of glance, these are major sources of suppression for their body. That these low-grade infections tie up a lot of their immune system, and their immune system then doesn't have enough sort of oomph left to deal with another secondary infection. So that's on the top of my list.
Wow. Would you say having the teeth issues that, like you said, suppresses the immune system, do you find there's a correlation with organisms living there and just the body's inability to fight them if the teeth aren't really dealt with?
Yeah, I mean, unfortunately, the sort of approach of modern dentistry is that if the teeth look good and they don't hurt, it's all fine. Now, dentists have a high sort of degree of suspicion on gingival disease, and the links of gingival disease with heart disease and autoimmune conditions are well known. I think the things that aren't looked for very hard are people who may have dead teeth or teeth, especially root canal teeth, because these teeth are chronically infected, they're dead, there's no way the immune system can get in there. They're full of toxic bacteria. There's a lot of biofilms within the tooth structure itself so that the immune system can't get to it. Yet the bugs, when you culture them, when these teeth are pulled and analyzed, when you culture them, the bacteria that are there often produce high levels of biotoxins, which inhibit normal cells from doing their normal thing, especially from making energy. The same thing can occur with cavitations. A person had a wisdom tooth pulled when they were 16. The place in their jawbone, especially lower jawbone, never healed in. There's bacteria that can be there. It can also be sort of a dump site for various kinds of toxins, heavy metals, chemicals, pesticides. And it's an area that the body can't get to very well. But these things are only a couple of inches from the brain. And the major nerve trunk that goes to the jawbone is the largest nerve trunk in the body. It goes straight into the midbrain. There's no sort of relay point. And so for the body, this is a potential great source of stress because, if the brain gets damaged or infected, then the major control of the body will go away. Even the consciousness of the person may go away. So the body takes this very seriously, and it mounts a big immune response in that area. And a lot of times these are asymptomatic. The person doesn't have pain, and you can't see anything wrong. And this is something we're going to talk about later, but a lot of times, unless you have specialized ways of diagnosing these things, you won't find them because it may or may not be apparent on x-ray, and often it's not even looked for because the person has no complaints. So it's a big issue. And when I get a chronic Lyme patient who's been to 14 doctors, that's the average of the people that come to my clinic. They've been to 14 doctors. Many of them have had years of antibiotics. That if they have dental foci, things in their mouth which aren't right, especially root canal teeth, I inside jump for joy and I tell this person, I am going to be able to help you because the major source of your problem is probably your teeth. And if we can clear that up, there's a good chance you're going to get better.
Wow.
This pans out over and over and over again.
Well, let's talk about that because it's interesting with your background, Dr. Minkoff. I mean, medical doctor, but specialized really infectious disease. Is that correct?
Correct.
So, I mean, with all the, typical ILADS doctors and prescribing antibiotics, I mean, what is your opinion on antibiotics and where do you stand on this whole topic?
Well, like you said, I did a subspecialty in infectious disease, and I worked with one of the most eminent infectious disease doctors in the world at University of California in San Diego. And we would meet with him every day, and I did antivirus research at the same time, is that, sometimes antibiotics can be life-saving and they're good. So I tell a patient, if you got bit by a tick 2 days ago and you've got a bullseye rash and you feel flu-y, I would treat you with antibiotics because the cure rate on that is very high. But if you've got stage 3 Lyme disease where you've got autoimmune symptoms, joint symptoms, neurological symptoms, chronic fatigue, immune suppression, I have not found that antibiotics are helpful. And most of the patients that we see have already done that. They've done antiparasitics, antibiotics, you name it. They've been on it for many times years, oral, IV, and they're not better. So our approach is that doesn't work. And there's some reasons why that doesn't work. I could maybe go into this right now, is that the Borrelia itself, this bacteria, is among the most sophisticated bacteria known. If you take your average strep or staph, they may have some things inside of them which are called plasmids. And plasmids are little pieces of DNA material that allow that cell to be resistant to something. So if the Staphylococcus is resistant to penicillin, then you need another drug or a methicillin-resistant Staphylococcus. It's because that basic germ, that basic bacteria, has some information that's gotten inside of it that allows it to not let the antibiotic work. And your average bacteria has between 0 and 3 of these little extra pieces of DNA, these plasmids, with which it can try to survive in the face of either the body's attempt to kill it or outside antibiotic sort of techniques. The Lyme bacteria has 23 of these plasmids, more than any bacteria known. So it has a repertoire of things that it can do to avoid being killed by antibiotics. It can change its basic shape. It can go dormant, which means it's basically asleep. If it's not dividing, the antibiotic won't have any effect on it. It can hide. It can go inside of cells. It can go inside of tissues. It makes a toxin that can block or kill our own cells that make antibodies. The CD57 test, which a lot of the patients that are listening to this may have had, is a marker for a certain type of lymphocyte that makes antibodies toward Lyme and TB. Those are the two main things that are known. But the bacteria has a toxin that will kill the lymphocyte. And so while, 180 or so CD57 cells would be a nice average range, we see some patients that might have 4 or 6 or 8 or 15. Their whole lymphocyte system, which is supposed to produce antibodies to kill this bacteria, has been itself killed by the bacteria. So the thing is very smart. It's very Fabian. It can hide. And so if you try to treat it with just antibiotics, it isn't usually successful. And so the things that we're doing to try to unburden the immune system, so fix the teeth. The other part of this, which almost always occurs, is that their intestine is under a lot of stress too. And usually what we find, and we do this with very objective testing, they don't have enough digestive enzymes. They don't have hydrochloric acid in their stomach. They don't have the right profile of good bacteria. A lot of these people have been on antibiotics and they've got 3 to 10 nasty, terrible, invasive bacteria, Pseudomonas and Enterococcus, and, bad guys in there that themselves cause inflammation, infection in the intestinal wall, but they also produce biotoxins, which then go into the system and cause problems other places. A lot of these people have yeasts or other kinds of funguses in their intestine. A lot of them, the immune system in the intestine is overwhelmed. They're what's called IgA, their intestinal IgA, oftentimes is very suppressed because they can't, the immune system's trying to kill these things off and it can't produce enough to even do it. Many, many people have parasites that they don't know about. And if the doctor is looking for LabCorp or Quest for parasites, it's pretty much a waste of time. But there are good labs in this country where you can find parasites, and many people have them. They have flukes, or they have roundworms, or they have ropeworms, or they have tapeworms, or they have blastocystis. And in Lyme patients, these things are very common. And if you don't fix this stuff, then the patient doesn't get better. So you have to heal up their gut.
Wow. I mean, you said the average bacteria has 0 to 3, was it plasmids?
Plasmids, yes.
And then Borrelia burgdorferi, or obviously the Lyme bacteria, has 23?
Yes.
I mean, just that in itself explains the complexity of really Lyme disease. And then, of course, as you're talking about all the other things that usually get associated with, parasites and other types of bacteria that kind of add in or jump in where the immune system's already suppressed and more things pile onto it. As you're talking about the gut and the gut digestive tract being such an important role, of course, people will a lot of times think that the main thing is, changing my diet. Where do you feel like foods and diet fits in for people recovering or really on the path to get their life back from Lyme disease?
Well, what I suggest with most people is they go on a paleo type diet. So they go off grains, they go off dairy, they go off beans, that they eat organic as they can afford, and that if it comes in a box or a package and there's any other ingredient on there besides what the food is, don't eat that. And that works for most people. So a peach is a peach, and a chicken leg is a chicken leg, and a broccoli is a broccoli. But what's a Triscuit, or a Cheerio? You just look on these things and it's just like chemical after chemical after chemical, and chemicals aren't food. So I try to get them eating this way, and almost everybody does well on it if they can get through the first 2 weeks. And we don't have any artificial sweeteners. Normal spices are fine. There's millions of recipes now and beautiful books on how to eat paleo. And my wife makes a paleo lasagna that if you came over to the house and ate it, you'd never know it wasn't real cheese. You'd think you were eating, regular lasagna. But the only exception I make to that is that sometimes if people have a lot of neurologic symptoms or they have seizures, I will try these people on a ketogenic diet so that they're, 80% of their calories are fat and only 10% protein and 10% carb. But mostly I start people on paleo, and I find that within 6 weeks, most of their chronic digestive problems, their heartburn is gone, their constipation is gone, their chronic bloating is gone. And of course, we do a lot of things at the same time. So we're giving them digestive enzymes and hydrochloric acid and good flora and something to kill off the yeast, something natural to kill off the yeast and the bad bacteria. I usually see people back at 5 weeks, and almost everybody is feeling better. And a lot of it just has to do with their gut. Now, some people have food sensitivities, and I may also at the same time do an LCAT test, or in our office, we have a way using electrodermal screening to screen people for food allergies. And, because they might be allergic to good foods too, that we got to pull them off temporarily so that it won't cause them problems with their gut.
That makes sense. The lasagna sounds amazing. Next time I'm in your area and your wife's preparing, I might have to invite myself over to your house. But you mentioned, 2 weeks with paleo, if they can get through the first 2 weeks. Is that more of the sugar craving that you find? Where does the 2-week thing come from?
I think it's sugar. I think it's, these glutens and gliadins and caseins are sort of, they're pseudomorphines, they're pseudo-opioids, or they act in the body like that, and that these people have a withdrawal. So I just say, for the next 2 weeks, you might suffer. You might find your blood sugars up and down. You may have some headaches. You may have some mood alteration. Just hang with it. The first thing on our diet, we haven't seen our dietitian, but the first thing on her list is, number 1, clean out your cupboard. I know from my own experience that 11 o'clock at night, nobody has any willpower. And if you're hungry and it's there, there's still some cookies stashed away, or there's some saltine crackers, or there's some, whatever your favorite ice cream, whatever it is, that you're not going to make it. So number 1 is clean out your pantry. Take it to Goodwill or to somewhere, or, get rid of it. And then fill your pantry with good food. And then when you're hungry, eat, but eat good food. And usually by 2 weeks, the cravings go away and people actually start to feel better. And then there's enough positive gain that they'll hang with me on it.
That's excellent. Yeah, I always tell people, when you start having the cravings at night, that's time to go to bed. Early to bed, early to rise. Stay away from all those snacks. You mentioned antibiotics and not a fan of it, which I would completely agree with you. My wife wouldn't have suffered for 20 plus years of chronic Lyme if antibiotics, IV and oral would have worked. So clearly that wasn't the answer for her either. But what are some typical supportive therapies that you tend to use more commonly, or that you feel is very valuable for people with Lyme?
Well, let me just mention one other thing. One of the things I learned when I was doing an infectious disease fellowship is that it really helps if you look at someone's blood under a microscope, because there's a lot of things that you can see. Now, a standard infectious disease approach, if someone is diagnosed with suspected syphilis, and syphilis is a spirochete, which is in the same family as Borrelia. So the way you're supposed to do it as an infectious disease doctor, if you suspect Borrelia or syphilis, is that you take a drop of the person's blood from their finger, you put it on a microscope, and you look at it under what's called dark field. Now, a regular light microscope puts the light up from below, and if you look at blood when the light is coming straight up from below, it's so pale that you can't see anything. So usually when laboratories look at blood, they stain it. And in the process of staining, the cells are all killed. So you have dead cells, and there's a fixative added so that they're dead. And then they put stains on, blue stains or red stains, so that you can see what's what. When you look at a dark field, you don't stain it and you don't put anything on it. But the light doesn't actually come from below. The way the microscope is rigged is that the light comes from the side. And you can see the shadows of the cells on the slide, but the cells are alive. And you can look at these white blood cells and you see inside there's actually motion. These things are alive. And you can look at the red blood cells and you can see how they're doing. And normally a red blood cell carries a little bit of a negative charge electrical charge on its surface, so that when it gets next to another red blood cell, it doesn't overlap. They stay a little bit apart. And when the red cell's doing well and when it's healthy, they stay apart so that when they circulate, they can give and receive oxygen and carbon dioxide the way they're supposed to. A lot of times when people have Lyme with nutritional deficiencies and toxicities, their red cells and the metabolism in their red cells isn't very good. And they don't have enough electrical charge, and the cells start to stack up. They look like a stack of coins. And when you look at the blood on a dark field, you can see this. And here they are. The blood is all stacked up. And so one of the supportive therapies is, if I see this, is if I put them on, it's called a mass mat, M-A-S-M-A-T. And it's a mattress that delivers a very low-level pulsating magnetic field. And it actually recharges the red blood cells, and it lasts from a few hours to even up to 2 weeks in some people. And if I look at someone's blood and their cells are all stacked up, and a lot of their symptoms are chronic pain, they have fibromyalgia, they have all these areas in their body where there's lactic acid buildup, and they're painful, and they have painful bumps all over the place. I know they're not circulating, and I know they're not delivering oxygen. And if I put them on this mask mat 3 to 5 times a week for half an hour, and then I look at their blood on Monday and it's bad, and I look at their blood on Friday, their cells are all recharged, and now their cells are circulating, and their pain will go down 50 to 75%. Just doing that.
Wow. It's like basically like a battery charger for the cells, in other words.
Exactly. And it not just does the blood cells, but it does all the cells, because their liver and their spleen and their kidney and their brain, when someone's got brain fog and they can't think and they can't remember and they can't sleep, their brain is not only inflamed, but it's not getting oxygen and it's not detoxifying. And by adding energy from the outside until you can actually get their metabolism working again and turn back on, is enormously helpful. And so that's sort of a supportive therapy that's very, very easy to do. And in fact, we have a lot of patients that they'll buy their own mat and they'll do their mat at home every day, and most patients love it. I try, if I can, to empower my patients so that whatever they can do on their own, they can do, which makes them independent.
Absolutely. Absolutely. Is there any other supportive therapies that are good that you like or recommend, or that's kind of the main one? And is that a form of basically like PEMF, P-E-M-F, the pulsed electromagnetic field therapy, essentially?
Yes, it is that.
Okay.
The other thing is, I find that it's very hard to get somebody better if you can't give them intravenous therapies. So we do intravenous cocktails with vitamin C, calcium, magnesium, B vitamins, and ozone. Ozone is nature's healer. It's nature's antibiotic. It's nature's restorer. If you have a bad injury and you use ozone, it will get better faster. If you have a localized infection or someone with a diabetic foot and you either put ozone on the surface or you inject ozone into the wound, it will kill the bacteria and rehabilitate the cells. So we use it in everybody, and not just sick people. I get a treatment of ozone every week. I'm an athlete. I want peak performance. We have a lot of professional athletes that come in because it enhances performance. It actually helps your mitochondria work better. But in someone who's sick, their mitochondria, which is where the energy is made in each cell, they don't work. And by getting that mitochondria sort of rehabilitated, it really helps. And the bacteria and viruses and parasites have no defense against ozone. When it hits them, it kills them. Our own cells have enzymes on the surface of the cells which inactivate the ozone. So it's not harmful to us, but it's very harmful to them. And when we look at the dark field, in probably 50 to 75% of the cases, we will see the organism swimming around in the person's blood on a drop of blood. You will see these Borrelia. They're spiral shaped. You see them twist through right on the field while you're looking at it. And, if you see 1 or 2 of these on a drop of blood, and your average patient has, 6 quarts of blood in them, and in one drop we see a couple of them, what it means is that there are millions of these things in their blood right now while we're sitting and talking to them, and the thing could be a hair's length away from a white blood cell, which could care less and isn't even paying any attention to it. The immune system's so either impaired or overloaded or suppressed that it's not doing it. And if you put ozone in the blood, you kill these guys because they have no defense against it. So it's a mainstream of our therapy, and it's very helpful.
Do you have a preference of, you mentioned IV ozone, obviously there's like rectal insufflation, there's, where you put it in the ears as well too, or do you find that they all have benefits, it just depends on the person?
Exactly. We have an ozone sauna, which is fantastic. It's heat plus steam plus ozone. It's another way. So most of our patients will do one or two of these therapies at the same time. And a little bit I go by how do they react to it and what do they find makes them feel the best. But I'll usually start people as part of detoxifying is put them in the ozone sauna for a half an hour, a couple times a week, and then give them IV ozone 3 to 5 times a week, depending on, if they're out of town, we're trying to do it fast. If they live in town, we would treat them less intensively. If they have a lot of sinus problems, the ear ozone is very good. And if they have a lot of gut problems, the rectal ozone is really good. If they have a big parasite load, the rectal ozone is really good because if you treat them with anti-parasitic herbals and then you give them rectal ozone, in many cases, right when they finish the treatment, they'll go to the bathroom and they'll see parasitic parts come out. So it's very helpful and it's very safe. There's no risk in these therapies.
Yeah, again, it goes to the importance of looking at your stool when you go number 2. Don't just go number 2 and flush. Look at what's coming out of the body. So yep. Ozone fits in the killing category of pathogens, Lyme, and probably, other associated, obviously, organisms like parasites. Is there any other things that really you're a big fan of that fit into that, pathogen elimination or killing category for Lyme and the other bugs?
Yeah, intravenous silver is really good. Silver is manufactured by, the product is called Argentyn 23. It can be used intravenously. It's 23 parts per million of elemental silver. It's not colloidal silver, and I recommend people don't use colloidal silver. In fact, I have a patient now who went on the internet and found how she could very cheaply make her own silver solution. And she did that for a year, and now she is as blue as a Smurf. I've never seen one in person, and I never thought it could happen, but there she is.
Wow.
In fact, when she first came in, I wasn't sure what her racial background was because it was kind of blue-gray, and I couldn't tell, was she some exotic mix, or where was she? And I said, this is before we really started talking. I said, well, where do your ancestors come from? And she said, oh, I'm Scottish-Irish. I've just had too much silver.
Wow. In that, I would completely agree with you, Dr. Minkoff, that to not make that stuff on your own, because I think isn't it the silver salts that can accumulate in the body, and then that's where that blue hue grayish can build up in the body?
Yeah, that's right. That's right. So this is elemental silver, and there isn't another company that makes a product that can be done intravenously, and I recommend that people don't use another one, because if you look at this product on a microscope, it's uniform. It's not clumpy at all. And it's called a hydrosol. These particles are actually suspended in water. And it's very uniform, and you can do it intravenously. The doctor has to be educated on it, but once you do it, it's very safe. And the combination I find of when we do ozone and IV silver, within 3-4 weeks, we don't see the Lyme bugs anymore. We don't see them on the microscope. And when we do our energetic testing, we generally don't find them anymore. It really handles them.
That's fantastic. Well, even silver, is such a traditional, if the silverware, was actually silver back in the day as far as, working on eliminating contamination. And they even talked about, before refrigeration with milk, that you literally put a silver coin in the milk to prevent it from souring just because of the natural, like, antibacterial type properties that silver has. So it's really, really neat to see the type of, cutting edge treatments that you're doing with patients. So because Lyme is definitely one of those, and you would probably agree with me on this, it's just so misunderstood, misdiagnosed, or really just not diagnosed. And there's so many things that can seem to mimic Lyme disease, such as like ALS, lupus, Parkinson's, RA, rheumatoid arthritis. I'd even say, MS or multiple sclerosis would kind of fit into that. In your opinion, being a clinician that just works with, obviously hundreds, thousands of Lyme patients, how many of the people would you say diagnosed with like these ALS, lupus, Parkinson's have Lyme versus, you know what I'm saying, the correlation with it?
Well, here's what I've learned, and this is a fault of sort of the way medicine is is practiced and the way medicine is marketed. And that is that in order for an insurance company to pay a doctor, he's got to have a diagnosis. And the diagnosis has to have a number next to it, a CPT, a code, and then the insurance company will pay for it. And so I think as an outgrowth of this system, what's happened is that someone will come in with a symptom and they will get a diagnosis made based on, yes, you have so many swollen joints, it's been going on for so long, and you have a blood test which shows that there's an antibody, a rheumatoid factor antibody, or an ANA to something in your blood, and that you then have a diagnosis of lupus or rheumatoid arthritis or multiple sclerosis. And really, those are great big wastebaskets which have a big question mark on the side, which is, we have no idea what's wrong with you. And all of our therapies are going to be immune suppressive therapies. We're going to give you steroids or chemotherapy or cytokine blocking drugs in attempt to so numb or castrate your immune system that the symptoms that you're having will go away. And at the same time, we're going to pretend that your risk of TB, cancer, serious other diseases, infectious diseases, we're going to just keep our fingers crossed and hope you don't get those. So what we're trying to do with people is actually find a real diagnosis. You know, if you go to the doctor with a sore throat and he puts a swab down your throat and he swabs your tonsils and he puts it on the plate and he grows it up and a strep grows and you have a fever and a sore throat and swollen glands, the doctor can say to you, you've got a strep throat and I'm going to give you X medicine and it will kill that bacteria and then you will be fine. And that is a legitimate thing to do. But to say MS isn't a legitimate thing, because what is it? What we're finding in almost all the immune diseases, the autoimmune diseases, and the neurodegenerative diseases, so ALS, Parkinson's, multiple sclerosis, lupus, is that people have Lyme. It's not the only thing that's wrong with them, but they have Lyme and its associated co-infection. So, you know, there's another dozen organisms at least that are associated with this. And some of them are parasitic, some of them are mycoplasma or anaplasma, some of them are Ehrlichias. You know, they're sort of all in between of things that are sort of halfway virus, halfway bacteria, different structural forms, and they can go back and forth from one form to the other, that these people have an infectious load, a big infectious load. And many of them have a viral load too. They have a smoldering Epstein-Barr or herpes 6 or varicella or chlamydia or mycoplasma. These things come along with this whole package. And the guy doesn't have just Borrelia. He's got usually 4 or 5 things that are going on in his whole system, plus another 4 or 5 things in his gut, plus he's got his bad teeth. You know, that's why they don't get better. There's just too many things wrong. And the approach of the doctor, if it's like, okay, let's figure this thing out, this big confusion, there's like a big puzzle in a box. Let's lay it out on the table. What have we got here? Oh, we've got Lyme and we've got anaplasma and we've got an Ehrlichia and we've got a Bartonella. And oh yeah, we got a Pseudomonas in his gut and 2 parasites. And then we've got his hormone levels are trash. He's got no testosterone and no cortisol, so we've got that to deal with. Then he's got a root canal teeth and bad gum disease. We got that to deal with. And then as we systematically pull this thing apart, we can then target what's wrong with him. And the other piece of this puzzle, which I didn't mention, but I want to, is that oftentimes because the gut is bad and because the nutrition isn't very good, is that they have major significant nutritional deficiencies. They have low amino acids. They have no vitamin D. They're low in selenium or zinc or essential fats. And their systems, their detox systems don't work. And their energy producing systems don't work because the stuff that's needed to make them work just isn't there. And that if you want to get somebody better, you got to pay attention to this too, because, you know, the very typical patient, you know, and I do all these lab tests up front. And when I see him back and we start going over these lab tests, they say to me, holy smokes, no wonder I feel so terrible. I say, yeah, you're not crazy. The last 3 guys tried to give you Prozac because they thought you were just menopausal depression, but you're not crazy. This isn't a mental disease. You have physical things wrong with you. And if we fix those physical things, everything will get better, including your Lyme disease. But if the doctor's not looking for this stuff, he doesn't know it's there. And if his Band-Aid is give you cortisone or give you Prozac, he's doing you a disservice. Or giving you, doxycycline for 6 months, he's doing you a disservice because he's not really doing his job of get a proper diagnosis of what is wrong with this poor person, and then you can help him.
Yeah, I would completely agree. My wife went through that. It got to the point where they didn't understand what was going on, and they just said it must be all in your head, and here's an antidepressant, antipsychotic, and move on. And I think it's important to dig deep and understand that. And when you're talking about so common with these diagnoses of the RA, MS, lupus, Parkinson's, they'll give a steroid or they'll do something that suppresses the immune system. I mean, in my books, that seems like that's medical malpractice to suppress the immune system in a case where there's clearly, pathogens or associated pathogens that could then just really take hold of the body even more so. Do you feel like that drives things deeper and worse?
I do. And sometimes in an emergency, these things can be useful on a very short-term basis, okay? But as a main line of therapy, it's just like the acid blockers. Okay, a guy goes to the emergency room and he's got a big open bleeding ulcer and you want to neutralize his stomach acid for 2 weeks so that his ulcer can heal. And the doctor prescribes him Nexium or Propulsid or one of these drugs as a 2 week to just shut the thing off so that the acid's not eating away further his bleeding ulcer. That to me makes sense, and I think it's good medicine. But then it's got to stop. Then when the ulcer's healed, then you got to figure out another strategy, like fix his diet, maybe give him some stomach acid that he might need, give him some digestive enzymes, figure out what foods aren't going to make his stomach upset. Then you're actually helping the guy. The original thing might have been in an emergency situation, helped him, but as a long-term strategy, you really are hurting them, and it's not good medicine.
Wow. You mentioned electrodermal screening when you were referencing teeth earlier, and I know you referenced, autonomic reflex testing and electrodermal screening. I mean, what's your opinion on that as really using it to understand the body energetically, diagnose, and really hone in on exactly what's going on with that individual patient?
Well, I think it's almost impossible to treat complex patients if you don't have a skill that tunes into the autonomic nervous system. Yeah, I tell patients this, look, we're gonna look at the body in sort of a 4-component theory of, look, here's all the things that could be wrong. It could be your structure. So you may need a chiropractor to adjust your back because your structure could be off. Or you need someone to align your teeth so that your jaw fits. That would be structure. Or if you fall down and break your ankle, you need an orthopedic surgeon to adjust that structure. So on one level, disease is structural. And the doctor's got to sort of keep this in mind all the time. On a second level, the disease can be biochemical. It can be a deficiency. It can be a toxicity. It can be a dioxin or mercury, or it can be a missing a hormone or a mineral. So you have to look at the body at the same time on that, because both things could be going on at the same time. You might need your neck aligned, and you might need some zinc or vitamin A or something to get the mercury down in your blood. The sort of third level is your autonomic nervous system. It's the part of the body that runs everything. You can sit here and walk around the block, go to the bathroom, blink, breathe, and not have to have your attention on any of it. Like the body pretty much runs itself as long as the autonomic nervous system is healthy. But when it is full of toxins or it is missing things, it doesn't function right. And virtually all of the symptoms that people get are because it's not functioning right. And that can be high blood pressure to they got a twitch or they got a pain somewhere. Their autonomic is not balancing things. And a doctor has to be able to evaluate this, because if he can't, he's going to get stuck fast. And a lot of times, as you're working patients through this sort of it's kind of an onion peel, like we figure out what are the biggest stressors right now. Okay, so he's got a root canal teeth and he's got a parasite and he's got a virus, and we treat that. And he says, oh, I'm better, but I'm not all the way. And I've sort of fixed the biochemistry that I can see, but I still have a guy who's not quite right, and I need another way to look at him. So if I do the autonomic testing, and I just had this happen. This is a 35-year-old Lyme patient from Canada who came down to see me a few months ago. And when he came, he was in a wheelchair. He couldn't walk. He'd had Lyme disease since 5 years old. He's 35 now. He had terrible pain everywhere. His main symptoms was he was too weak to walk, and he had terrible pain everywhere. And we did our sort of basic thing, fix the things that we already just talked about. And within 3 weeks, he was walking with crutches, and by 6 weeks, he was walking alone. And his muscle mass returned to his legs, and his pain went away everywhere except for the side of his face, right below his ear. And he still had terrible pain there. And on the autonomic nervous system testing, what I found is that he had some chickenpox virus in that area, in the nerve in that area. I would have never found this with a physical exam or with a laboratory exam. When I then treated him with a homeopathic for chickenpox and a targeted herbal for chickenpox, he got a huge resurgence, and he actually remembered that at 5 years old when he got sick, he'd actually had chickenpox. And he had this realization himself, was this started the sort of first thing that suppressed his immune system, which then when the tick bit him, he got Lyme.
Wow.
And he's all but normal now. He's gained back 25 pounds of lean body mass. He's walking around. He's doing really well. And you wouldn't find it with that. And the doctor would be then sort of like, try this, try that. Maybe it's this. It's all just a big guessing game. But if the doctor can do some form of autonomic evaluation, you can find these things, and the body will direct you to here's next, here's next, here's next, here's next. I had another one. This guy's from Germany. He was so toxic, and he tried a lot of doctors, and he was very reticent when I first saw him, and he was just like, I don't know, I don't trust anybody. So I've been working with him very slowly because he's very sensitive. His main symptoms were he felt like he was so anxious, and he had such morbid depression that he was most of the time afraid that he was just going to die and that it would be a relief if he did. And I found that if he got colonics 3 times a week, within 30 seconds of finishing a colonic, all his depression went away and his anxiety went away. It was almost like magic. And we took him through a bunch of these levels, and then he said, I'm really better. I'm really better. I can actually walk around the block now. I can exercise. I can work. There's just something left, some little thing that's left. And the thing that I found on him, this was last month, was that he had a high sensitivity to electromagnetic fields. And that's what came up on the autonomic testing. And I said, how do you do around cell phones? He said, I can't be in a room where there's even a cell phone on. And basically, I stay in my house all day long. We treated him to the geopathic stress, to this stress from electromagnetic fields. And at once, when he came back, he took out his cell phone and he turned it on and he held it in his hand. He said, this doesn't bother me anymore. This is a miracle. So these things are, if you have a way to tune in to the body and the autonomic nervous system, it will direct you to where you have to go so that in the right order, you can fix this person so that the thing that you're doing is actually de-stressing them and not stressing them. And I want to give you a really good example of when this is done wrong. This is what happened with my wife, and this is what got me into this whole thing, is that, she looked at her teeth. She's an athlete. She's a nurse. On any given weekend, she will win her age group or be a podium spot in a triathlon wherever she goes. And in 1995, she looked in her mouth and she saw rail-to-rail mercury fillings. She said, I don't like the way these look, and I've been reading about mercury and it's poisonous, and I want to get these out. Okay. She goes to a dentist who advertised as he could remove mercury safely. He didn't know how to do it. He took her mercury out. In 6 weeks, she had thyroiditis, and then she couldn't lift one arm, and then a week or two later, she couldn't move her leg, and she was diagnosed with MS. And I'm an emergency room doc at that point in my career, and I'm like, what the heck is going on here? And in her body, and this isn't the only one, I've seen at least 100 people since, they take their mercury out and they get sick. Or they find a well-meaning doctor who says, oh, we should give you chelation because you have mercury and that's probably why you got chronic fatigue. But they don't tune into the autonomic nervous system to find out what is the priority. And if the priority is fix the gut and get rid of the parasites and get the nutrients back in so that the guy could detoxify, and he's giving her something where now he's going to pull mercury out of her body or his body, and then the body can't even handle the mercury and it's just another load on top of all the other loads, then they just get sicker. I've seen that happen many, many times. So that's why I say I think the doctor has to have a way to see what's the health of the autonomic nervous system and how to direct their therapy so that they're working with the body and not against the body.
That is just fantastic advice, Dr. Minkoff. I mean, that's where people can spend years, going to the traditional physician and not be getting better because things aren't really targeted at what they need, essentially.
That's exactly right. And I think, the medical profession has been so kind of crazy on nobody else knows what's going on, and the whole thing that went on with chiropractic, with the AMA and the
Wilkes versus the AMA case.
Yeah, the whole thing is that something can be said for naturopaths and chiropractors, and that these guys, I learn from them when I want to learn how do you approach a body, unless, I'm in the emergency room and he's got a bullet in his chest, or he just fell down 3 flights of stairs and he's got a closed head fracture. Okay, fine. Or I got to deliver a baby stuck and you got to do a C-section, or the guy's got an appendicitis, or the guy's in the middle of an acute heart attack. Okay, medicine is like brilliant. You want a doctor who knows his stuff. But somebody who's got some chronic illness, you want a doctor that can actually tune into the autonomic nervous system. And a lot of chiropractors and naturopaths, as part of their training, this is what they learn, and it's good medicine, and it's the way you can get people better.
That's excellent. Well, again, thank you so much for joining us on the Chronic Lyme Disease Summit. As you've heard from Dr. Minkoff, antibiotics are not the solution, even though it's the quote-unquote typical medical route for Lyme disease. And it's really important, with Lyme disease and other mysterious illnesses, that we must look at the body as a whole, holistically. And Lyme is just more than just a tick bite. So definitely take this life-saving, life-transforming information that Dr. Minkoff went through home with you by clicking on the banner beside or below. And definitely share it with your friends and loved ones. They're really depending on you. And don't forget to visit Dr. Minkoff online at his clinic. It's lifeworkswellnesscenter.com. Again, it's lifeworkswellnesscenter.com. Again, Dr. Minkoff, thank you so much. Maximum blessings. This is Dr. J. Davidson.